Certainly do like our options here in South Africa, don't we? Especially when it comes to our health care. About 80% of Africa's population relies on traditional medicine for their basic health needs. In some cases, this is the only healthcare service that's available to them. Between the 26th and 31st of this month, so it's been a couple of days already, we're commemorating African traditional medicine. Let's talk about the significance of indigenous medicines and where does it fit into what many call modern or Western medicine. It's always good to hear Dr Fundile Nyati and him making time for us this morning, founder and CEO of Proactive Health Solutions. Morning, Doc. Good to have you back on eNCA. So where does traditional medicine fit in a health framework in our country? Is it right up there, do you think?
I think your introduction was spot on. For the majority of the people of South Africa, especially those who are in rural areas, it is usually the first form of healthcare that they interact with before they get to interact with the biomedical or Western medicine, as we normally call it. So it is very important. In fact, from a WHO point of view, traditional medicine should be integrated with primary health care to ensure quick and easy access to the healthcare system. Unfortunately, in South Africa, up until 2007, that was not the case because traditional medicine was outlawed based on the Health Act of 1974 and the Witchcraft Suppression Act of, I think, 1953. So only in 2007, when the new act, Traditional Health Practitioner Act 22 of 2007, was actually passed, was traditional medicine, acknowledged and recognized, and efforts are underway to ensure that there is close collaboration with the Western healthcare system.
How do you try and broaden this then, if it's such a great idea, and I think many would agree, especially in rural areas where you could be hundreds of kilometers in a worst case scenario from any local clinic? How do you try and keep track of what is becoming traditional medicine as opposed to someone just making it up to try and get some money from some poor gogo living in a village?
You're right. I mean, through the healing spaces, there will also be fake people who try to do what they are not licensed to do. Now, this Traditional Health Practitioner Act 2007, number 22, its aim was to create an interim council similar to the HPCSA that will then regulate in terms of who is a traditional health practitioner, what training should they have, and who can prescribe what medicine, and also who can issue a sick note and things like that. However, the process has been very, very slow to regulate that. We now have a second interim council of the traditional health practitioners, which still has to make sure that that work is done, because up until that work is done, protection of the public from those who are actually taking chances will continue to be elusive. So it is important that that regulation process is speeded up, because it's now almost 15 years since the act was passed.
I can't help but think, and I'm not going to draw any direct comparisons, Doctor, to the BRICS countries and the BRICS summit that was here last week, but I do think of two countries, one of those when it comes to traditional medicine. One of those is China and also India as well, very big in their traditional medicines, perhaps their regulation of it. I'm not too sure what your thoughts are on that. How do you compare South Africa to, for example, China and India on traditional medicine?
I'm glad you have mentioned the two countries, and in fact, the Prime Minister of India, President Modi, he actually spoke about the need for collaboration between South Africa and India, because India is one of those countries through what they call Ayurvedic medicine, has actually taken traditional or indigenous, healing to the next level, even with universities. China does the same. As we speak, one of our professors in South Africa, Professor Mutalipula Matsalisa from University of Free State, who is a pharmacist, is one of 9 experts in the world who are attending the first WHO summit on traditional medicine, representing South Africa, representing Africa, the region, the sixth region of the WHO. So we are very much behind. I'm glad that in his work as a researcher, he's collaborating with Beijing, University of Chinese Medicine. And so there clearly is a lot of work that we need to do, but that will be fast-tracked by us collaborating with those who are already ahead of us. And India and China are definitely the two who happen to be in the BRICS. And they have actually recognized and regulated this space such that we don't have the kind of problems that we have here, because we have not researched our indigenous medicines here. As a result, it is difficult then to simply promote, because the issue of safety of patients is of prime concern. So also from the Western medicine point of view, or what we call biomedical medicine, which I'm qualified in, there needs to be education of us as well, because we tend to have a very negative attitude to matters of traditional medicine. Yet we need to be informed, we need to learn about it, and what has been found elsewhere in the world is that traditional health practitioners are actually much more likely to learn from biomedical doctors, and be able to improve the way they do work. So we need to regulate, we need to educate, the biomedical doctors, but also we need to do research and prove effectiveness, dosages, and other ways, of administering traditional health medicine.
I'm glad you spoke about the summit that's on the go at the moment, Doctor, as well, the World Health Organization Traditional Medicine Global Summit. It's going to be a big talking point. I'll tell you why I want to raise it, because I see an article referring to a traditional medicine that is being used or repurposed, not used, let me be very careful with my wording, repurposed for COVID-19. As well as part of a traditional medicine framework. Tell me the significance of that, because COVID-19 is still very relevant. Yes, we aren't in lockdowns, of course, but it's still very relevant today. Tell me about that. What do you know about it?
Well, I think most of us know that around 2020, the president of Madagascar, President Rejolina, came out and, announced that they've got a treatment for COVID-19, but that was shut down because there hasn't been much research that was done on that particular, medicine. And now that medicine is a relative of a medicine that we have here in South Africa that is called umhlonyane. So Asian nations have been using that particular traditional medicine. In fact, it's the first-line drug nowadays for malaria. So, there already is use of that traditional medicine in mainline, or mainstream, medicine. So it is important then that that initial claim is backed up by scientific research, and I know that Germany and US have actually been, working on the research part to prove the efficacy of that particular medicine. So the mistake that Madagascar did was to quickly announce without doing proper scientific research. So I think what is important then is that medicine must continue to be researched, and Prof. Matsarisa from University of Free State is actually one of the people in the continent who has been named as somebody who must play a role in the COVID-19 search for medicines. And so I am glad then that this WHO summit, G20 countries, that is in India, is actually looking at this medicine as well.